Hello,
Hi.
Tina. How are you doing
I'm
today?
doing well. How are you?
Good. So I'm Michael, nurse practitioner student, United States University. I will be filming this examination today with your permission.
Yes.
Okay, this will be seen by staff and possibly students. Today we're going to be conducting a neurological examination. Okay, this is going to consist of a few different components. Okay, so first thing, of course, I'm looking at my patient here, just generally observing for facial symmetry, facial droop, that type of stuff. Talking with her, I'm listening to her speech pattern, looking for aphasia, that sort of stuff, of which I hear none. So, you've already verified your initials for me. Can you tell me what your date of birth is?
3188.
Okay. And can you tell me where you're at today?
I'm at the clinic.
Okay, good. And what year is it?
2023.
What?
I'm sorry, Mike.
Okay. What year is it?
2022.
2022. Okay. So she is alert and oriented to person, place, time, and situation. She knows why she's here. Can you tell me what you had for breakfast today?
I had an apple.
I had an apple. Okay.
Mm-hmm.
And can you tell me what the first car that you ever had was?
An Acura Integra.
Okay. So we've assessed her short-term and long-term recall. Okay. Now tell me, if you were walking down the street and someone's cell phone fell out of their back pocket in front of you, what would you do?
Pick it up and try to get it to them as soon as possible.
Just checking to make sure that you make reasonable decisions.
Yes.
Okay, so that concludes the first part of the examination. Okay, the second part, we're going to be talking about the cranial nerves. Now, I'm going to run through this pretty quickly because that's the way that I'm used to doing it, and then we'll go back and we'll talk about each thing that we're doing. Okay, typically in the clinical setting, we would not assess the first cranial nerve, which is the olfactory nerve. And this is being very presumptuous, but we're supposed to say, okay, include one there and smell this ground coffee or perhaps orange oil or something like that. But you may have never smelled coffee before in your life, and I don't know that. And if I give you coffee to smell and you say, I don't know what that is, then I'm going to think something's wrong with that first cranial nerve. I think an easier way to assess that would be to simply ask, have you noticed any changes with your sense of smell?
No.
Perfect. Okay, so we're going to move on to the second cranial nerve, which is the optic nerve, and we're going to do that with our Snellen chart, which we have here. This would be done at 6 feet out, which we don't have 6 feet in this room, but what I would ask Taryn to do would be to, with both eyes, read the smallest line possible, and we cover left eye, keep the right eye open, read the smallest line possible. And then we'd flip that, uncover the left, cover the right, read the smallest line possible, and take it from there. Another way that we can assess for that second cranial nerve is confrontation. Okay, so let me know when you can see my fingers.
Okay.
Okay, and I'm gonna get over here, and same thing.
Yes.
Okay, and then we would do this with both, and making sure that that's an equal field of vision for her. Okay, the next thing that we're gonna do is we're going to assess those pupils. So instead of using my pen line, I'm just going to use my ophthalmoscope since I have that handy. So I want you to just stare at my nose for me. And again, just like we did with the head, eyes, ears, and nose and throat, I'm examining for direct constriction as well as indirect. So indirect meaning that the opposite pupil or the contralateral pupil that I'm shining the light in constricts as well. And that did that. We're going to go ahead and take a look at that optic disc again. So I will dim the lights. I'll put my hand right up here. I want you to just pick a spot on that wall and stare at it. And I'm going to get this lined up. We're going to look for that red lens reflex, and there it is. And we're moving in. And I can see the optic disc and cup, and the vasculature margins look good. The ratio of 1 to 3 is good. And there's no AV nicking, no cotton wool spots, anything of that nature. I know you're blind from that, I'm sorry. Same thing, I have you stare at a spot on the wall and just keep staring at that spot for me. Same thing, I'm gonna get in here, get that red reflex and zoom in, and there we are again. Very nice. Okay, good. And again, nothing abnormal with that. We'll go ahead and turn those lights on. Okay. Now, I'm gonna have you tilt just a little bit towards me here, that way we can kind of see what's going on. So first thing I'm gonna go, not the first thing, next thing I'm gonna go ahead and check is that 8th cranial nerve, that vestibulotrochlear, that's the one that's responsible for our hearing. So, can you hear that?
Yeah.
Good. Okay. Now we're gonna play a bunch of games.
Okay.
Okay. I want you to close your eyes for me real tight. Real tight. Scrunch them down. Good. Don't let me open them. Good. Now open them up big like you're surprised. Raise your eyebrows up. Good. Puff out your cheeks. Stick out your tongue. Wag it side to side. Okay. Good. Now what I want you to do, I don't have a tongue blade with me. I'm gonna have you tilt up. Go ahead. Say ah. Okay. Looking for equal rise and fall of the soft palate with that. Okay. I want you to turn into my hand for me. Turn into my hand for me. Good. Shrug your shoulders. Good. And one last thing we forgot to do with those eyes is follow my finger, checking that 3rd, 4th, and 6th cranial nerves through extraocular motion. I'm going to bring that out to the sides, looking for a nice nystagmus, and which we didn't see any. So, like I said, 3, 4, and 6, that's the movement of the eyes. Okay. The other thing we didn't check here, does this feel the same? Both sides? Per my rubric, I'm supposed to be testing if you can check dull and sharp. So, how does that feel?
Soft. Sharp.
Okay.
Soft. Soft. Sharp. Sharp.
Okay, so she's able to discriminate between those two. And let's see here, that is the trigeminal nerve right there, or the 5th cranial nerve. Okay, 9, 10, and 12, that's the hypoglossal, the vagus, and the glossopharyngeal nerve. That was the sticking the tongue out, wagging it side to side, equal rise and fall of the soft palate. Spinal accessory, or the 11th cranial nerve, that was the shrugging the shoulders or turning the head in towards my hand. And that is a down and dirty cranial nerve examination. So now we're going to have some other fun stuff here. We're going to do some cerebellar or higher functioning type of nerve studies. So first thing we're going to do is rapid alternating movement. Okay, so I want you to take your hand and put it in your hand like this and flip it over and just go until it's okay, and then switch for me. Okay, good. Another way we could do that is I could have you do it on your lap. Same thing, both hands at the same time, okay? We can also check for ataxia, have you touch your nose and then touch my finger and keep going. So I'm giving her a difficult target because I'm moving around. Go ahead and switch up for me. Okay, good, good. Okay, other cerebellar type of function stuff we're gonna do, we're gonna have you walk, okay? First thing I want you to do is go ahead and stand up for me. And unfortunately, she has a boot walker in. So because of a stress fracture, so I'm not gonna have her participate in this. You can go ahead and sit back down. What we're gonna do is we're gonna talk about it. So what I would have you do is just have you walk across the room, checking your normal gait, looking for any antilogic gait. On the way back, I would have you do the heel to toe walk, just like if you know you were getting pulled over for something you shouldn't be doing. You do the heel to toe walk, and then back to the other side of the room on her heels, and then back to me on the tiptoes. Okay, and that's all cerebellar function. Go ahead and stand back up for me. We are going to check for something called Romberg's and also for pronator drift. Okay, so what I want you to do, palms up. Put those hands about shoulder width apart, okay? Go ahead and close your eyes, tilt your head back, okay? Okay, she's able to maintain her balance, keep in that position, and the arms came back up, good. You can sit back down. Made sure that I was protecting her back while we did that. I don't want anybody to fall, okay? Final part of this is that we're going to go into reflexes, okay? We're going to demonstrate deep tendon reflexes, and then we're going to talk about superficial reflexes. Okay, so I'm going to take my reflex hammer. Now, before we do that, I guess we're going to do some strengths as well. Okay, so shrug your shoulders for me. Good. Push out at your elbows. Good. Pull up. Now push down. Good. Squeeze my fingers for me tight as you can. Good. Pull me towards you. Push me away. Good. I want you to lift up with this knee. Good. Lift up with this knee. Good. Go ahead and kick out. Good. And pull back. Again, she's got that boot walker on. If she didn't, I would have her plantar flex and dorsiflex her feet. We can also check sensation. Again, you can actually use my reflex hammer for this. So sharp, dull.
Yes.
Okay. So
Sharp, dull, sharp, sharp, dull, sharp, dull.
okay. All right. Other things that we can do to test sensation would be 2-point discrimination. I don't have anything in here to do a 2-point discrimination with, but typically I would take a paper clip and I would unfold it. And what we're looking for is that if you can tell me if 1 or 2 points are touching you. An expected finding for this would be things that have a higher ratio of nerve endings on it, such as the fingertips, palms of the hand. You would be able to feel those 2 points closer together. Whereas up here you may only feel it as 1 because there's less nerve endings. So the less nerve endings, the wider we expect that 2 points to be. The more nerve endings, the closer we expect that to be. Right? Clear as mud, right?
Yep.
Okay. All right, let's check some deep tendons here. So I want you to relax for me. And we're going to check that triceps tendon. Okay, very good. Let's see here. Now I'm going to have you put your hand right there. Just relax on mine. And we're going to check that biceps. There's that. Continuing to relax here. It's all positioning here. Continuing to relax here. Going to check on that radial. Okay, good. We're going to repeat the same thing on the other side. Bring that arm. Just let that dangle. There it went. Good. Let's see here. Gotta get that biceps. Sometimes these are difficult to find. You got a watch on over there, but we just we want to rest that arm, want everything to relax. And that's a tough one. All right, have you scoot back a little bit. Okay, so we want those knees just dangling. As a distractionary technique, what I found to be very effective is what I want you to do is like you're doing a chain breaker, okay? When I tell you to, I want you to look that way and I want you to pull, okay? Go ahead, look that way and pull for me. There it is, okay, relax. Look over that way when I tell you to pull, pull. There it is, okay, good. Final reflex that I would check with her would be over on the Achilles. I'm not gonna check the left, she has the boot walker on. One of 2 ways you can do this. The way I prefer is I just go ahead and dorsiflex that foot, take my reflex hammer, and I hit that Achilles and I feel for that pushing down on the gas. Those are your deep tendon reflexes. Superficial reflexes include, I can do a corneal wisp test where I take a wisp of cotton, touch your eye. You should look away from that. Superficial abdominal reflexes, where if I were to take something like this from the umbilicus and go out, the muscles of the abdomen will follow the direction at which I'm stroking. Let's see here. In men, you can test the cremaster reflex, which is the inner side of the thigh. Stroking up will make that side of the scrotum rise. And then, of course, on the foot, you have Babinski's reflex, which you would start at the heel, up the arch and across the ball out in a lateral fashion. And you should, as a normal finding would be either no response or toes curling in. If the toes go back out, then that is considered an abnormal response. I'm trying to think if we missed anything else. I think we about covered everything on that. Like I said, I like to run through those cranial nerves down and dirty. It's just getting into our routine and going through it. But anyway, that's going to conclude our neurological examination for today. Thank you.
No problem. Thank you.